Hi, this is Robin, and this is my daughter Jordan, and we're going to be demonstrating Dr. Schallenberger's bioenergy testing, on the Korr Cardio Coach. This is a really simple test to do, nothing to it. I have made a little sheet here for all the techs. Your patient comes in, you put in your heart rate monitor, put the heart rate monitor on them. You need your patient's name, date of birth, height, weight. You're going to get all this, sitting blood pressure, standing blood pressure, body fat, and the FVC. FVC is forced vital capacity. And you can buy this. This is separate from Dr. Schallenberger's software. You have to go to the internet. Everything is on in the packet that you'll receive when you purchase the machine. This is the FLOMAR, is the Medical International Research, MIR. So you can go there to purchase, and I believe it's like $500. So we're going to demonstrate the FVC. You're going to open up the software on your laptop. Here's your little thing. You're going to have a disposable flow meter. You're going to adjust that in there. Your patient is going to put that in their mouth. They are going to have their nose plugged. They're just going to breathe normally. That's all you're going to do. You're going to go to the FVC, and what you're going to do is just have them breathe normally. Then you're going to ask them nice and gentle to push all the air out. Then they're going to take a huge breath in, as big as they can. And then they're going to blow and keep pushing till I tell them to stop. Keep pushing, keep pushing. Deep breath in. All right, we've done it. This is disposable. You're going to throw this away. You're going to accept this test if you have this software or whatever software you have. It's going to give you predicted and your FVC1, which is the patient's what the patient did. And we're going to need that for the bioenergy testing. So input all that information. We're done with part one. We're going to exit out of here. Now we're going to open the cardio coach. It's the big heart there. We're going to open it up and we're going to be sure it is connected. At the bottom it will say connected. It'll give you a 5-digit number. You got to make sure it's there. We're going to open this up. Looks like a little bike on the far left. This is for a new patient. We're going to open that up. We're going to hit new. And we're going to put in the patient's name, weight, height, what their goal weight might be, gender, date of birth. Then you're going to hit OK. So let's put in Jordan here. Let's do this. Sorry. And we'll do this. She's a female. Do the drop down window, female, date of birth, hit OK. Then you're going to look down at the bottom of this little box you have. It has test type. It says treadmill in there. There is a drop down menu. You're going to go to RMR. You're going to click on that. You're going to hit OK. Now what this little cardio coach is going to do, it's going to calibrate. It's getting humidity, room temperature, barometric pressure, all that kind of stuff. This takes about a minute and a half. All right, we've heard our little beep, and now it says it's waiting for first breath. So that's what we're going to do right now. This comes with the cardio coach. This is all disposable, so it's sanitary. You're just going to open it up like that. This comes with the cardio coach. You're going to put this on. Nice and easy. Your patient is going to have this in their mouth. They need a good seal and never break the seal. And that's what you tell your patient. And you do their nose. Now, they're looking for a heart rate also and a stable breath. You're just going to put on the heart rate receiver on the tube. That's really easy. Nothing to it. And she's just going to sit there, relax, and we're waiting for the cardio coach to calibrate one more time. It's got a heart rate, which you can see, it's 66 beats per minute. We have about 6 seconds, so it has a countdown here that you're looking at. Now we've hit it, it's gotten calibrated, and we hit OK, and there we go. Now, this part of the test is, takes about 12 to 13 minutes. Now, it'll run, and you'll see the graph, and you're just looking at the graph. We're looking at the VO2s, which it gives you down here, 3.7. Now, if the VO2s are below 1.4, there might be something wrong with the breather. You might have to change it. Some people can be below 1.4 because these patients are coming in fasting. Nothing but water after 12 midnight. If they take thyroid, they do take their thyroid, but that's it, and prescribe medications. So we're looking here, her heart rate is good, and her VO2s are good. This part of the test will take about 13 minutes. So now we are 5 minutes into the test, and everything is going well. The VO2s are well. She has a good heart rate. Now this test will, like I said, will go to maybe 12 minutes, and the machine will beep if we are having a nice stable breath and heart rate, and the VO2s are stable. But if it doesn't beep, you're going to have to let them go a little longer, like 13 to 14 minutes, and then you're just going to have to hit the stop button, and you will get accurate information. But if it does beep, fine. If it doesn't, you're just going to have to go a little longer, for 12, 13, 14 minutes, and then hit stop, hit OK, and then you can print out your information. Now we've finished the test. Jordan's gone a little bit, longer, just because we needed a stable VO2. So I'm just going to hit the little stop sign up there, up top left. It says end the test now. You hit yes. And there you go. What you're going to do is take all this out, get off your heart rate receiver. Nothing to it. Disconnect, take this off, put it back in your basket. This we can toss. Now we're going to go up to print. Let's go to print. Then you're just going to go up to print, and you're going to print out the test, and it'll print out 3 sheets, and that's all there is to it. Now we're moving on to the third part of the test, which is the exercise part. And we've already done the RMR, which is the resting part. So now we're going to go over here on our cardio coach to commands. You're going to hit new test. We already have the information, so you're going to have, it says customer. We're going to do the drop down menu. You're going to find your patient. Is all you're going to do. You're going to open up that part, and then all you're going to do is come down to test type. Now this is important. We're going to find there's a load ergometer that we want to find, or you can also put in different wattage, which is very easy to do. And that's all explained in the book that you will get with the cardio coach. And we're just going to put in, we're going to double click on what we want to do. The load ergometer exercise test, that puts our wattage on how the bike ramps harder and harder each minute at 15. And then all we do is hit OK. Now, as you can see, a different screen has come up, and it's waiting to calibrate. Again, that's all we're doing is waiting to calibrate. This takes about, a minute and a half. All right, our cardio coach is calibrating, and it's waiting for first breath. So now here's the bigger hose. which we're going to hook up to the mask. So I will demonstrate the mask and how to hook all that up, and then we'll wait for first breath and heartbeat. Okay, here we have the mask. This is very easy. We're going to put on our patient. They're going to hold that right there. I'm going to slip this down. Nothing to it. We're just going to tie up the sides so we don't have any leaks. That's what we want to make sure. Turn around just a little bit. There we go. Let me get this side. All right. Now what I usually ask the patient to make sure there's no leaks, that they take a deep breath in and they're going to blow. Now if they feel anything around any air escaping, you're going to plug up the hole. When they blow, you're just going to tighten up. If it's, she says she's getting something around her eyes, you're just going to take this and tighten it up a tiny bit. Repeat the same process, and that's it. And then you put them on the bike. All right, so now we're ready to do the exercise part of the test. This is very simple. We have the bigger hose. We have our patient with the mask on and everything. There's no leaks. So we've calibrated the cardio coach. It's waiting for first breath and heart rate. We put the hose on here. We're going to put the receiver on the hose again. It's not so hard with the bigger hose. There we go. And now it's waiting for us for first breath. So we're going to have to hook it up. And we're going to put it right here, make sure there's a good seal. I'm going to lay this over here for the patient, and it's just waiting for first breath and heart rate. We got our heart rate, and we're just waiting for first breath for the VO2s, and we will start the test. The cardio coach has calibrated again. Now it's waiting for, it's telling us to begin. We hit OK. Is all we're going to do. And she's going to start pedaling. Now she has good leg extension. I'm going to ask her to keep the RPMs on the bike at 60 and 60 only. There is a watt screen on there. It shows her that the bike is getting harder. And as the bike gets harder, you just want to keep it on 60. Now the plot map is on the screen, and we're just waiting, for her to become anaerobic. Now, also with the cardio coach, as different from the bioenergy, the cardio coach will say on the bottom of the screen that she's reached anaerobic at a certain point. We are going to wait for the RERs to get to 1.05. So our anaerobic is different from the cardio coach. All right, our patient has been pedaling along here for 3 minutes, and the wattage is up to 65. You want to make very sure that you watch the wattage, because you're going to want the wattage when you quit, when you stop the test, because you're going to need to input that into the bioenergy software. So what we're looking at right now is the plot map. At the very bottom, you can see where it says VO2 versus time. We're going to come to RER versus time. You're just going to click on that, because this is what we are interested in for the bioenergy test. As you can see, the plot map. Here is RER versus time. Here's 1.0. We're looking for 1.05 for the bioenergy. So we're waiting for this little line to climb up here to the 1 and go past it just a bit to get our results for the bioenergy test. She's breathing harder. You want to encourage them. Don't give up. Keep going. Excellent. She's looking good. She's been on 7 minutes. Very good, very good. There we go. We're starting to climb again. She's in good shape. She recovered well. All right, she's doing well. Here, we're looking for her heart rate. The wattage is up to 155. She's above the line 1.0. She's anaerobic, and it's saying anaerobic. It's saying down here also, do not pay attention to this anaerobic on the bottom line. We're looking at this only for the bioenergy testing. We're doing good. She's reached her point almost. There we go. We just wanted to track, and as you can see, it's done it. We're going to hit stop, the little hand. There we go. All the watts are coming off. You're going to hit peak. That's what we want. All the watts are coming off. She's going to get easier. She has time to recover. Her heart rate's 154. VO2s are good, so she's going to recover for 1 minute. It says that on the cardio coach. She's been on 31 seconds. I usually give them a minute and a half, depending on how hard they have worked. So good test, excellent test. Very good, perfect. Once she's done the recovery, we're going to hit stop. We're going to hit yes. We're done. Now we have our test, our patient's done. We're going to go up here to the printer, just like before for the RMR. We're going to hit the drop-down menu. We're going to hit print test results. We're going to hit print. You're going to come down here. We don't want all the graphs for the bioenergy. You're going to come down here to pages. We just want page 1 and page 2. That's all we want, because that shows the bike time down, everything that was happening minute by minute when she was on the bike. And then we hit OK. And this is going to print out. All right, now here's the fun part. What we're going to do is minimize this. We are going to go, we don't need that. We're going to go into the bioenergy report. You're going to open up this report. You're going to find your patient. You're going to scroll down. We're going to open this. Now what you're going to do is control. You're going to just highlight it. That's all you're going to do. Then you're going to do print. Now here's where the software comes in. It shows the patient's name. You're just going to go to next. The gender, female, age, height, weight. It's going to have everything you need, and then you're going to hit, all that information's there. You're going to hit next. We're going to do their blood pressure sitting. And then we're going to do blood pressure standing. This is really easy. We're going to do their body fat, which we have collected. And then we're going to do, here's our watts. That's why it's very important to know what the wattage was. And her watts were 140. There we go. This is the FVC now. This is the forced vital capacity, which we have done already with the spirometer. So what you're going to do here, we have predicted, which we knew that was a 4. We're going to put that in there. Then we're going to come over here to what the patient did. And the patient did a 3.25. Then we did our respiratory rate. When they were resting, we were counting for 1 minute, just their respiratory rate, and hers was 11. That's all there is to it, and now we're going to print it out. Okay, we have printed out our bioenergy test that Jordan has done, and this is what you give to the doctor. This will give you the energy quotient, biological index, the resting metabolic, your M factor. This is everything that the bioenergy test consists of. So that's what you're going to want. And also, I want you to keep, because the cardio coach does not keep the information that you input for the bioenergy test. So this sheet, I always put on the back of everything that I have put here for this test on this date. I put on the back, so if I ever have to go back to reprint the test, I have all that information to input again. All right, now we're going to clean masks in between patients, and it's very important that you do that. We're going to use cavi wipes. Make sure you have gloves because this kills everything. You're going to unscrew everything, and there's a little filter in here. You're going to want to make sure you have that all cleaned inside and out with the valves. And this baby inside and out. And also the mask. Inside and out. You can buy another mask. I believe they're like $500 if you're doing several patients. But I find that if I just clean in between, I'm good, and I usually do 4 to 5 patients a day. Also on the bigger hose that connects to this mask, I bought 5 from Korr, just so they're dry, in between each patient. So that's it. If you have any questions, my name is Robin. Please call me and I'll be glad to help. Thank you.